Performing CPR for children is similar to CPR for adults and infants, but there are some key differences. First, it's important to define a child. A child is a person 1 year old to the onset of puberty, evidenced by breast development in girls and underarm hair in boys. This is usually around 12 years old. Start by making sure the child is on a firm, flat surface, like the CPR board we have here. Also, be sure the bed is at an appropriate working height. You'll perform chest compressions using the same technique you would for an adult, but you'll compress to a different depth. For children, you want to compress the chest about 2 inches deep. Expose the child's chest. Then place the heel of one hand in the center of the chest, on the lower half of the sternum. Place your other hand on top of the first and interlace your fingers, and hold them up so they're not resting on the child's chest. Position yourself so your shoulders are directly over your hands. To help keep your arms straight, lock your elbows. Press down on the child's chest about 2 inches. Use a rate of at least 100 to 120 compressions per minute, like this. 1 and 2 and 3 and 4 and 5. As you do, allow for complete chest recoil. 13, 14, 15. For a small child, you may only need to perform chest compressions using one hand instead of two. When using one hand, be sure you're able to compress the chest about 2 inches. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Keep in mind, the ratio of compressions to ventilations when you're the only provider is the same for a child as it is for an adult. That is 30 compressions to 2 ventilations, 30 to 2. When multiple providers are performing child CPR, the ratio of compressions to ventilations changes to 15 to 2. That is 15 compressions to 2 ventilations. I'm going to use the same compression technique as you would for an adult, but I will compress the chest only to about 2 inches.
And we'll provide the ventilations. Since there are multiple providers, we'll use a BVM to deliver the ventilations. Joan will open the child's airway to a slightly past neutral position and seal the mask using the EC technique. The BVM should be correctly sized for the child to ensure an adequate seal. I'll provide ventilations by depressing the bag about halfway to make the chest begin to rise. It's important to provide smooth, effortless ventilations that last about 1 second. Ventilations that are too fast or have too much volume can be dangerous. Ready?
Yep.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15. And we'll continue cycles of CPR. 1 and 2 and 3.
Switch positions about every 2 minutes. The compressor calls for a position change by saying switch in place of the number 1 in the compression cycle.
Switch and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15.
1 and 2.
As with any patient in cardiac arrest, if a child shows an obvious sign of life, stop CPR and monitor the airway, breathing, and pulse.
15. 1, 2, 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, 13, 14, 15. 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, 13, 14, 15. 1, 2, 3.
Stop CPR. Jackson's moving.
1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000.